Hello. Hi. Today I'm going to talk about heart failure and heart attack. Many people think that they know the difference, but they assume the difference. They do not know the difference between heart attack and heart failure. So today that's what I'm going to talk about. There are nurses I talk to in my office and outside, and I discuss with them, do you know the difference? And they told me the difference, but it was not the different thing. It was not the thing which it is. So what is heart attack? Heart attack basically is, this is a heart model I have, and heart is supplied by blood vessels. This model is not perfect, but the blood vessels run like that, and they run across the heart. And what happens is sometimes the blood gets clotted in these vessels because of cholesterol, because of plaque formation over the years, because of multiple reasons. Those reasons could be smoking, hypertension, diabetes, cholesterol, and all those things. So whenever the blood gets clotted inside the heart vessel, the muscle of the heart is a muscle basically, it does not get adequate blood supply. So when it doesn't get adequate blood supply and it is pumping all the time, the heart muscle pumps whole life. So when it is not getting the blood supply, it kind of dies and there is a severe pain. And when the supply is cut acutely, then you have severe pain, like which is called myocardial infarction, or which is called heart attack. Sometimes a big area is involved, sometimes a small area is involved, and basically that is heart attack. When the blood supply to the heart muscle is not good, and it is most likely, if it stops abruptly, then that is called heart attack. Now, what is heart failure? Again, as I said, heart is a muscle, and I will show you how it doesn't exactly look like that, but kind of similarly it looks like that. So heart is a muscle, very good muscle. So there are two types of heart failures. There's a systolic heart failure and diastolic heart failure. So systolic heart failure is when the heart cannot pump good, and diastolic failure is when the muscle of the heart becomes stiff and it cannot relax, because to pump, heart has to relax, and if it doesn't relax, then it cannot pump good. So there are two types of heart failures. So basically it is a muscle problem. Heart failure is a muscle problem, and it is not attack. It can come because of the heart attack. Heart failure can be the number one cause, in fact, is the myocardial infarction and heart attacks and ischemic heart disease. Basically, ischemic heart disease is the number one cause of heart failure. But there are other causes of heart failure, which include high blood pressure and hypothyroidism, amyloidosis, hyperthyroidism, hemochromatosis. There are so many other causes. Arrhythmias like irregular heartbeat, sometimes atrial fibrillation. A lot of elderly people have atrial fibrillation, which is the cause of heart failure. So how do you treat those heart failures and heart attacks? Heart attack is usually an emergency, you end up in the hospital, but heart failure is a long-term thing, and basically you take medications which are prescribed by the doctor. Do exercise as prescribed by doctor. Do not smoke. Cut down your salt intake. Control your blood pressure. Control your diabetes, and control any other symptoms and associated diseases. So please, this is going to be on YouTube. So please click the subscribe button and the bell button. And thank you very much.